Well, hi there. Warm welcome. You're watching, and I'm Meghna Deka. Well, viewers, we ask you a simple question. In that quest for the fountain of youth, are we actually making a death wish? Are fillers really our friends or our foes? The reason why we even need to discuss all of this is because these are medicines, these are injectables, these are drugs that people have been pumping into themselves in the hope, in the only hope that we continue to look younger. Nowadays, people are obsessed with looking forever young. Aging has become a problem, and it is an important problem to fix for most people. It's not a process to embrace, but it's a problem to fix. Nowadays, even the young people, can you imagine, people in their 20s, people in their 30s also go for expensive treatments and they take medications. They do things to their bodies, to their skin, especially to their faces, which can even have adverse side effects on their health. But why go through all of this? Shefali was taking anti-aging drugs. The police have found that Shefali was taking these medications for many, many years now. That she had injected on that fateful day, injected herself with anti-aging medicine while she was fasting. Anti-aging medicines were advised to Shefali about 8 years back, but she continued till date without further medical supervision. She also took anti-aging medicine every month and every day. The police are now probing if anti-aging drugs caused this cardiac arrest. But also the FSL team has found a lot of pills from her residence as well, which they are looking into, anti-aging medicines. Their beauty oils, gastro-related pills also have been found. There may have been other existing preconditions like epilepsy, which are being looked into, but the health has now been brought back to the spotlight. Well, according to sources, Shefali was reportedly consuming a mix of anti-aging treatments, multivitamin pills. There were skin whitening supplements as well as high doses of anti-aging capsules as well as PANDI-DSR drugs. This is just some of the things which were used, and many said perhaps misused. If misused, they can strain internal organs. They can trigger off side effects, especially the use of PANDI-DSR, which is a medication which is meant for acid reflux. There you have it on your screens. She was taking this as well. Now, this is one of the drugs which sometimes misused along with supplements. Regimes have now also raised red flags by the medical fraternity. But she's not alone. There are several celebrities across Hollywood, across Bollywood, who have opted for various transformations. You can see some of these transformations there on your screens. You have none other than the likes of Jennifer Aniston, Justin Bieber. You can just see some of them on your screens. Many of them have achieved their desired looks. However, there are those who have faced unfortunate complications during the entire process. In fact, let's take a look at some of these stars and how they themselves have spoken about it. Well, you have, of course, Shilpa Shetty right there behind me. Shilpa Shetty has admitted that she once got a nose job done. Then you have Sherlyn Chopra. Sherlyn Chopra has admitted that she got a breast implant as well as Botox done. Then you have Koena Mitra, who has admitted that she got plastic surgery. And there's Priyanka Chopra, who has spoken about how in her early years of the career, she got a nose job and she was devastated after that with the side effects. Of course, there's Rakhi Sawant. She's been very open about it. She's talked about the Botox, the lip fillers, the breast augmentation, everything that she has admitted to. But it's not just here in India. It is there across the world. Look at some of the biggest stars who have been coming in. For example, from Hollywood, you have Hailey Bieber. NAD IV therapy is what she has undergone to look younger. And what we are doing here is you can see the before and after pictures. Look at Kendall Jenner as well. There is Hailey Bieber there on your screens, the way after the transformation, many transformations that she's carried out with the NAD plus IV therapy. Then there are others as well in Hollywood. We are going to show you the others. You have Kendall Jenner, another very famous star, and these are all young people, remember. Then, of course, you have Joe Rogan, who has also had this therapy. This is the before and after pictures that we are getting for you. Many of them have openly talked about it. There's Jennifer Aniston. She too has talked about the collagen supplements. There are others as well who have said that some of them have been a mistake. You also have people like Justin Bieber there on your screens, what he used to look like and what he does now after the therapy. Brian Johnson, of course, he's one of the biggest names which have been coming in for people who have embraced the kind of procedures, the steps that he has taken. He says that he now, being 50, he now feels like he is an 18-year-old. He's got the body of 18-year-old. Of course, Brian Johnson has a supplement regimen as well as plasma transfusions, he says, which makes his body youthful. He's just the extent, perhaps, that people have gone to when it comes to looking young. Of course, then you have Madonna, who has said that she's had Botox, she's had filler, she's had lasers, several other procedures as well. These are just some of the names which are coming in. Of course, there are many, many more. But let's tell you how it's time that people start embracing their natural skin. And it's important for that, for us to point out that you must embrace the natural skin, because at the end of it, plastic and Botox fillers perhaps cannot replace what the nature has in store for us. The pursuit of anti-aging treatments might seem appealing, but it often comes with hidden risks. In fact, these are the procedures which can damage the skin over time. They have been many serious consequences overall on health as well. There are side effects of many of the modern treatments, and some of them are very, very severe and often underestimated. In fact, let's tell you what the side effects are. For example, retinoids. Now, this is something which is being used extensively by many people across several households. But a retinoid, for example, can lead to skin flaking, redness, irritation, skin peeling, sun sensitivity, hyperpigmentation. That's just to name a few. There are dermal fillers as well that people have been using. This can, as you can see, lead to swelling, to bruising, to allergic reactions, blocks blood vessels as well as skin sagging has been reported. Botox, something which is being extensively used now, many of them not under proper supervision as well. This can lead to muscle weakness. It can lead to droopy eyelids as well as droopy eyelashes and eyebrows. Also, facial symmetry can just go off because of that. There's also difficulty in swallowing or speaking due to excessive Botox. There are chemical peels which people have been using, laser treatments that they've been undergoing. This may lead to redness, scarring, it can lead to burns, it can lead to infections, it can lead to skin discoloration and delayed healing as well. Of course, anti-aging cream. I think almost every household in India in a certain income bracket will have anti-aging creams. But this, remember, may just cause hormonal disruptions, skin thinning, contact dermatitis, increased risk of cancer. These are just some of the problems that may happen. Now remember, Botox is one of the most popular anti-aging fixes. Quick, it's injectable, widely glamorized. But Botox may not be as risk-free as it seems. In fact, let's tell you what a recent study reveals, that 1 in 6 Botox injections leads to complications. It ranges, of course, in the severity, be it bruising, be it swelling, to more serious side effects which may be coming in, like muscle weakness and pain. In fact, in the UK alone, there have been about 9 lakh facial Botox procedures which are performed every year. Imagine 9 lakh procedures every year in UK itself. In fact, a number which continues to rise despite the fact that there is a 16% complication risk. This despite the fact those who are aware of it would still opt to go in for Botox to look younger. Remember, the global obsession with staying young is now a booming business. In 2024 alone, you have anti-aging products. The market is estimated to a whopping, and you can see the numbers there behind your screens there, $52.44 billion in 2024. So look at the numbers. This perhaps explains as to why it's being advised to you and why you're being pushed into it. It's not just about getting bigger and better. The fact is, do you really need it? According to the latest market analysis report, this industry is projected to soar to $80.6 billion by 2030. Let these numbers sink in before you get that next Botox. Also growing at a compound annual aggregate of 7.7% from 2025 onwards. But viewers, before turning to anti-aging treatments, you can keep your skin youthful. What's wrong in trying to look young? You can, however, also do it in a healthy manner, simply adopting the right lifestyles. Here, let me walk you through a more natural path to sustaining and reaching the fountain of youth. You can prioritize a skin-friendly diet, drink 2 to 3 liters of water daily. You can aim for your 7 to 8 hours of sleep at the night. You can choose to wear sunscreen daily to ensure that there is less exposure to the sun. You must manage your stress. You must practice yoga, perhaps even medication, and avoid bad habits such as smoking and limiting the alcohol. So let me go across to our panelists and get you a sense of what really is going wrong in our lifestyles, that we are being pushed towards this fountain of youth, which may just be a death wish. There is Smita Malhotra. She's an actress as well as a voiceover artist joining us. Dr. Prashant Pawar is also joining us, a consultant at the Interventional Cardiology at Fortis Hiranandani Hospital. Well, Dr. Pawar, I'm going to be coming to you first because these statistics are honestly very, very disturbing. If we look at Botox, which is being thrown around, such a casual word, 1 in 6 such Botox injections, there are complications which are being. What's really pushing educated people, people who may be aware of it, towards this fountain of youth when we know that it's fraught with risks? Dr. Pawar, if you can hear me?
Yes.
Yes, that question was for you.
Unfortunately, in our country, there is no legalized, we don't have a thing where only doctors can do it. Nowadays, so many quack practices are going on. This Botox is easily available on an OPD basis. People have opened their clinics who are non-dermatologists, who are non-allopathy practitioners, and they are using this left and right in all indications or not indicated things, So the horizons of Botox have increased. What is there in the guidelines, they are not following those guidelines, and the conditions in which those are given and the ambience and the hospital, the clinic cleanliness is so poor, where we have seen so many complications associated with them, right from the site infections to anaphylactic shocks. Patient land up with hypotension, palpitations, and many times we have seen this anaphylaxis causing death also. So definitely in our country, there is no legalization. We don't have a strict rule where only certain specialties can use this under certain guideline, under certain conditions only. People are using left and right.
And that's a very relevant point. Perhaps we need stricter guidelines as well. Who can perform these procedures? Now, every alternate household has been turned into this makeshift clinic, and you can go and get Botox without even proper medical consultation being provided. Now, Smita Malhotra, if we look at what happened in the case of Shefali, she, of course, it is being reported she unfortunately passed off cardiac arrest, but she was, there was also a sudden drop in her blood pressure, 8 to 9 health supplements, anti-aging compounds that she was on. These kind of pressures, is that common? These kind of heavy doses of medication to keep yourself youthful, is that unfortunately the reality of the film industry?
I'd like to differ. It is a reality of the film industry, but it's the reality of life, I feel. Because just like doctor mentioned, why are there so many clinics, mushrooming? It can't be just the industry keeping them alive, right? It's the norm of the society. People have become so obsessed with clones of each other. I remember when I began the industry, like you have short hair, I have short hair, but 25 years back, actresses were not supposed to have short hair because that was the stereotype that was given. But now everybody just wants to be clones. So my point is, if there are so many people obsessing over, how they look and the way there are so many mushrooming of clinics, that means there are so many unhappy people with themselves. I think that is the point that we need to be looking into. Are we so unhappy with the way we are that we need to go out there and get all these, things? Everybody knows that they are not risk-free. Everybody knows that they come with complications. Yet, and it's not just the industry. I have had friends from my building who openly in dinner talks, have these conversations. That, I just got a Botox. Oh, I just got this. Oh, I got that. And they are not from the industry. So I think it's the rampant cause is we are so unhappy with ourselves. And I think that is the sad part of the whole thing, more than anything.
I think you've hit the nail on the head there, Smita. I totally agree with you. Yes, in our circles, in our neighbors, within our friends, there are a number of people, especially once they hit their 40s. Fillers is the new thing, PRP on the faces. Those are just some of the things which are simply thrown around in a liberal conversation over dinner, for example. But Dr. Pawar, it's hard to tell people you should get happier. Let's say that people do want to get it. Many say, you're dyeing hair. What's wrong in trying to look younger? So, Dr. Pawar, what's your advice for people who do insist that they want to? What are the risks that they are looking into? Where should they go? And how careful should they be? And also, what should they avoid?
See, when we see for this anti-aging therapy, we as a doctors, we divide as the 4 therapies. One, the hormone replacement therapies, because as we age, the estrogen, testosterone, human growth hormone is going to go down. Second therapy, what we call as telomerase activators, which halts your chromosome degradation. Third, we divide as senolytics, where it prevents the cell division. So what is this glutathione? It falls in the senolytic agents. And fourth is what you are discussing about, those cosmetic procedures like Botox and all. And all these senolytic therapies, especially this glutathione, which happened in this case, these are all in the trial phase. Human data is lacking in these cases. This is all in the trial phase, where we have seen, even in animal studies, it is known to cause cancers. It has shown to cause blood clots in the vessels, and it also caused heart attacks also. So without a doctor's, professional trained doctor's advice, this therapy should not be continued as long. It can have an adverse effect. It can cause heart attack. It can cause fast heart rate, palpitations, or it is also documented to cause sudden cardiac death. So this all therapies are in trial phase, Unfortunately, in our country, we don't have strict guidelines. Abroad you go, there are FDA rules and all. Here we don't have those rules. People practice left and right. There is a fixed dose of glutathione. You should not increase beyond that. People are giving 20 gram, 30 gram, 50 gram. So they are crossing more than 5 to 10 times of the prescribed dosages also. These are known to cause anaphylactic shock, where suddenly your pressures can go down, what probably might have gone in this case.
Right, her BP dropped.
And maybe the dehydration has precipitated it. So I think it has to be under trained guidelines and trained doctors' prescriptions.
It's very important to have medical supervision and also quality medical supervision, let's call it that. But Smita Malhotra, if you see some of the faces, for example, you've had Courtney Cox, who played Monica on Friends. Everyone would say, what is it that she doesn't have? What does she have to feel insecure about, to feel unhappy about? But what should stars do? Perhaps go the yoga way, perhaps meditation. What should they be doing to handle the stress?
For sure. I mean, like I said, the way we look is also largely the way we feel inside. So Shah Rukh Khan, if you look at him, who's one of the most, iconic actors, and women love him, he's not a conventional good-looking man. He's not a typically conventionally good-looking person. I think the reason why, I said I want to come on today's show is because I think this is something even I've been wanting to let people know, that you've got to start from somewhere inside you. If you are not feeling good, even that, that Botox that you do, 10 days later, you'll notice something else which is irregular on your face. Yeah. So I think this thing of even, the way medical procedures are being advertised so casually, I think that is a problem too. How it's become a 15-minute fix. You go in your lunch break and you do whatever you want and you come back looking. I think that also needs to be looked into, the way we are advertising. Simple things like, I got a blood test done and the guy is selling me, if you get this package done, I'll give you this much free. It's a blood test. It's a medical procedure. We're selling it these days, medical procedure.
I think that's one of the biggest takeaways. And this is something that even Dr. Pawar has said. We need rules. We need rules now. We need medical oversight. We cannot have any quack sitting in a corner doing these procedures, because this fountain of youth is fraught with fatal dangers. And no, it is not being overemphasized. We cannot emphasize it enough. That only if you feel happier from inside, no amount of Botox and fillers perhaps can really make you happy, is what Smita Malhotra says. Thank you so much. I appreciate you, both of you, for joining us here on the show. Without a short break, don't go anywhere.